If you're someone that's noticed that your rib cage is a little bit wider after pregnancy, or working with an upper diastasis, or maybe even have a lot of neck and shoulder tension, this exercise is for you. What we're gonna do is we're gonna use a side plank with a weight to basically help squeeze the ribs from either side to help close the rib cage. What that'll do is that'll help bring the ribs into more of a narrow position in the front while getting more expansion into the back. That'll help restore breathing mechanics for our diaphragm and our pelvic floor to function better, to help take less strain out on the front. It can also help us not go into that shallow breathing pattern that can contribute to neck and shoulder tension. So let's go ahead and try it out. So what we're gonna do here is we're gonna have an elevated surface. We're gonna put a forearm on it. You can play with that surface as you need to. Then we're first gonna start off in a side plank where we're gonna have this little bit of a kickstand of bottom leg is straight, making sure I'm on the blade edge side of that foot versus rolled and collapsed in. That's gonna help me make sure that I'm using the glute med on my bottom hip here to push into the ground and lift me up out of the side. Making sure you get that glute med kicked in is gonna help get a better connection to your bottom side obliques. Then for the top leg, we're gonna have it be in front here and kind of lift with it a little bit to also help lift our hips. My shoulder is right over my elbow versus up here or down here, so I'm using that serratus to lift out of the side. So even just being here, I should feel some nice connection with my bottom side obliques here. Now, what we don't want is to bend so far here that then we flare this side, because that's just encouraging this side to flare even more. If you're someone that has a wide rib cage, we want to get that squeeze from both sides. So then what we're going to do is we're going to add holding a weight. What the weight's going to do is help pull my left shoulder blade around my rib cage to squeeze my top ribs in. And it also gives me some extra feedback of not sinking down, but oh, I have to lift up and away from the weight of the weight. I'm gonna hold here as I inhale into my back and between my shoulder blades and down into my hips. And I'm gonna exhale, thinking about letting that weight get a little heavier, pulling my shoulder blade around as I keep lifting up in my bottom side abs. So as you hold that for a few breaths, you should really feel how everything kind of gets squeezed around from the bottom side and from the top. Now, when we're there, we want to make sure as you're holding that weight that you don't flare forward or round everything around. We're thinking that we're using that weight almost like this kind of old school cross body stretch here, where I'm using the weight to pull my shoulder blade around and open up this space between my spine and my shoulder blade to create better areas of expansion. Another contributing factor to kind of more flared bottom ribs here is that if other parts of your rib cage aren't doing their job of expanding. So we're thinking about closing off the area that likes to be too mobile with the load, and then using that inhale and position to get breath into those other places a little bit more. So it should really feel nice and engaged and connected afterwards with it. And then you would want to do the same thing on the other side. Hopefully, after doing this a few times, that you start to feel that as you go to put your bra on, it doesn't feel as tight. Maybe you can have a nicer 360 breathing pattern that doesn't go up into your neck and shoulders. And maybe you notice improved resting tone in your abs. The one other thing to make sure of is that as you're kind of creating more compression up top here, is that we're not closing off here and creating more pressure down with putting pressure into our lower abs or into our pelvic floor. So you're always making sure that those lower abs stay nice and flat for every amount that you're exhaling and feeling your rib cage compress. Getting a good inhale will help with that. Keeping nice good length in your spine as you go to do it versus coming into a crunch will also help keep your pelvic floor and your lower abs safe as you work on closing those ribs.